Okay, so let's talk briefly about Charcot neuroarthropathy. Charcot. Just to give you a little taste of what this looks like, here's an x-ray from a patient recently. This was back in January. Let's see, hopefully you can see that. And this is one from yesterday. So he came in with a red hot swollen foot and couldn't figure out why it was going like that. Now, a little story about him: he had frostbite when he was a child, and has had loss of sensation below the ankles ever since. So it's pretty serious. So anytime you're going to see Charcot, you're going to see no feeling to the feet. Normally it's from diabetes, but it can be things like I said, like frostbite, alcohol usage, and the list goes on and on. So what you see in Charcot is you see a nice pristine foot turn into a rocker bottom foot. So this basically pops outward. And so if you remember from the x-ray I showed you, it starts to do that. So these bones have fractured on the inside of the foot. Normally, if you feel like your foot's getting sore, you'll change the way that you walk or stay off of it. But with these patients, what happens is the bone itself will break inside the foot, and they don't even know about it, and they keep on walking. And so the foot gets very red hot and swollen. And some docs think they have gout, infection, and we'll start going down that route. And infection can be kind of tough because sometimes you develop a hole here from the bone pushing on it, and you do have both infection and Charcot. So what do you do if you think you have this? Well, first you get looked at immediately, you get an x-ray right away, and you can tell. Basically all the bones will start to look fuzzy. And if you're in a very early stage of Charcot, you can be in a cast, like a walking boot cast that goes around your foot and has some support there, so that when you're walking, well, the cast would look like this. It supports that area of the foot so that you don't have any of that loss of arch, and that it gives it a chance to heal straight. Even with doing that, sometimes it's hard to keep that foot in a good position. So we call that a plantigrade foot, because this part's planting down versus elevating up. So plantigrade foot. Make sure you don't have gout or infection, but this is the thing you got to worry about if you don't have feeling to your feet. So be sure to get expert opinion. Sometimes you can reconstruct the foot to look more like this, but that's done not to restore 100% normal foot function. That's just to keep those ulcers from happening, because your body can handle weight when it's distributed between those areas. So we'll call that the classic tripod. 1, 2, 3. But if you have Charcot, you lose these and you just go to there and there. And that spot on your foot is not able to handle pressure. So that's what the surgery is reserved for, and it has a lot of complications, especially if it's related to diabetes, because diabetics tend not to heal as well on their foot. So hopefully that was informative.